Hello, everyone. Welcome to another incredible edition of Ask Dr. Dansinger with world-renowned diabetes reversal expert, Dr. Michael Dansinger. He practices if you have insurance, and that is, I think, if you have Medicare, if you have Medicare Advantage plans that are PPOs in the states of Virginia, in Minnesota, in New Hampshire, in Massachusetts, or Florida. He's slowly creeping across the United States. He could be the miracle you've been looking for. He is a diabetes reversal expert and he works to personalize your diet for your situation. So make sure you check into it if you're in those states and keep checking in with us here. Subscribe to our channel. You can go to Michael Dansinger MD on YouTube, or you can go to The Way to My Heart on YouTube. Subscribe to our channels to get notified of great content and to find out more when he's getting into other states. Today, we are tackling a very important issue, which is the convergence of diabetes and peripheral artery disease and kidney disease. This is the ultimate recipe for disaster. It is so hard. So many patients are dealing with all three of these. Well, let's say even four. Heart disease, if you have PAD or peripheral artery disease, poor circulation in your legs, likely have it in your coronary arteries, in your heart as well. And that would be heart disease. So Dr. Dansinger is going to help us sort things out because across all four of these, diet is so important, but you could get conflicting information or conflicting things based on whether you have kidney disease, diabetes, PAD, whatever it might be. So, Dr. Dansinger, can you sort this all out for us? I mean, the big problem, diabetes leads to kidney disease, leads to PAD, leads to heart disease. I mean, how do we stop this vicious cycle?
Kim, great topic, great questions. I see many patients who have diabetes who are at risk for kidney disease and peripheral artery disease. Some of my patients already have kidney disease or peripheral artery disease. And everyone needs an eating strategy. Food is medicine. And when you have multiple conditions, it can be harder to find the right eating strategy. So, diabetes is the leading cause of kidney dialysis, and high blood pressure is another leading cause of kidney dialysis. And many people who have um, kidney disease already have high blood pressure or diabetes. And so prevention is so important for people with high blood pressure or diabetes because you want to be able to prevent kidney disease as well as peripheral artery disease and heart disease. Once you have kidney disease, it limits the way you eat. So it's already hard enough to eat right for diabetes or blood pressure, but if you add kidney disease on there, it just adds complexity. And so we'll spend a, some time talking about that. The reason diabetes and high blood pressure is so damaging to the kidneys is because the kidneys are a delicate filter. So the kidneys filter the blood and help clean the blood. And um, if your blood vessels are getting damaged, it can be damaging to the kidneys. And so the delicate capillaries in the kidneys are damaged by high blood sugar and high blood pressure. And so that's why it's so common in type 2 diabetes. Well, in type 2 diabetes, everyone knows that you can't be eating a lot of sugar or processed starchy foods like white bread, white rice, white pasta, all the white foods. Even though they're not made of sugar, they're made of glucose or starch, which turns to sugar or glucose. But while someone without kidney disease is able to eat more protein to help them decrease the amount of starch they're eating, if you have kidney damage, then we can't push the protein nearly as high. And that's the root of the conflict in people who have diabetes and kidney disease.
Yeah, can we dive a little deeper into that and get into the recommended protein intake range for someone with both diabetes and kidney disease, and whether or not, and this is one of your favorite topics, are plant proteins better than animal proteins in this type of situation?
Sure. So we start to limit dietary protein in kidney disease when we see that there's damage to the in the urine. If we see that there's protein in the urine that's leaking from the kidney. So the kidney should not be leaking protein into the urine, but it's a simple urine test. And if the doctor is able to find on a urine test that there's excess protein in the urine, then that's a sure sign of kidney disease. And then we want to be very careful with the amount of protein. And so, kidney disease has stages, and we use the GFR, the glomerular filtration rate, to measure the kidney's function. And so once your GFR is starting to dip below 30, that's pretty advanced. That's stage 4 kidney disease. And um, so we measure the GFR. You can think of it as percent kidney function. So if your GFR is 30 or less, you're at 30% or less kidney function. That you certainly need to be very careful about protein. But even if you're above that, if you have protein leaking into your urine, it's time to limit protein. The amount of protein to limit depends on your body weight. So if you take your body weight, let's say 180 pounds, and divide that by 3, that's a good formula for the amount of grams of protein that's your max. So 180 pounds, divide that by 3, that's 60, and we'll call that 60 grams is your limit. If you weigh 150 pounds, we can divide that by 3, that's 50, and so that translates into 50 grams per day as your limit. So that's your formula. It's your body weight divided by 3. That's the limit of your protein intake if you're keeping careful track of your protein grams. In someone without kidney disease, you might be eating twice that much protein safely, but kidney protein can be hard on the kidneys. Animal protein is a little less gentle on the kidneys compared to vegetarian protein. And so you really want a mix of protein types. Red meat is especially hard on the kidneys if you have kidney disease.
And does that include even the grass-fed, grass-finished types of meats, the wild, and also does that include fish?
Yeah, so I think red meat is probably the hardest, and highly processed, deli meats like pepperoni or bologna. These are hardest on the kidney, even grass-fed beef. It's because of the type of, protein, amino acids in that type of protein that's harder on the kidneys. So fish is a more gentle type of protein. Tofu is gentle. Eggs and egg whites are a more gentle protein. So those are some of the, poultry. So I would say, if you have protein leaking into your urine, then you want to focus on moderate amounts of egg whites, fish, poultry, and tofu as leading sources.
So if you're a diabetic, then what do you eat that's
What
going to
can
keep
you
your
eat?
blood
Yes,
sugar
that's
down?
right. That's the dilemma. You can't
Yes.
eat too much protein, you can't eat too much carb, and you can't eat too much fat. So everything has to be in balance and everything has to be in moderation. So in but you can still eat some protein. I wouldn't say you'd necessarily want to become vegan, because that might be too starchy and might fuel your blood sugar issues. And so, to help preserve the kidneys, the most important things are controlling your blood sugar and controlling your blood pressure. And so, you want an eating strategy that's going to control your blood sugar and your blood pressure and avoid too much protein. And if your kidneys are almost to the point where you might be needing dialysis soon, then you have to start to be very careful about foods with potassium or phosphorus.
Yeah,
So,
can you address those phosphorus and potassium
sure.
restrictions? They, of course, as you just stated, could be necessary to restrict if you are in late stages, especially of chronic kidney disease.
Yeah, if your kidneys are functioning at, 25% or less, then you're really going to need to be very thoughtful about how much potassium or phosphorus is in the food. And you would definitely want to be working with a dietitian who has experience working with kidney patients. So, high potassium foods that you're going to start to limit once you're getting to, low kidney function would be tomatoes have a lot of potassium, or potatoes, which I'm not crazy about anyway. Cooked spinach has a lot of potassium in it. Cooked chard, cooked tomatoes. Mushrooms. A lot of those foods are an issue. Winter squash can have a lot of potassium in it. If you boil it, that helps remove some of the potassium. Avocados have a lot of potassium. And then other fruits like bananas, oranges, um, cantaloupes, honeydew have potassium. Mangoes, kiwis, dried fruits, and pomegranates are all issues. But there are plenty of fruits and vegetables that are low in potassium. So you'd favor fruits like apples, berries, um, apples and berries. What else do I have here on my list?
Or
Um,
fruits,
oh,
oranges,
uh,
citrus fruits.
yeah, peaches and plums. So peaches and plums, berries and apples, I think would be my top fruit recommendations. And then for vegetables, I would say you want to really focus on cabbage, cauliflower, green beans, zucchinis, bell peppers, broccoli. So vegetables that are low in potassium are your best bets of what to eat most of. They're good for arteries, they're good for weight, they're good for everything. They won't raise your potassium. And then phosphorus foods, high phosphorus foods are highly processed foods. So all the, many of the, many, 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 many junk foods are loaded with phosphorus. And then colas are an issue. And then also certain types of shellfish have, clams and mussels, crabs, sardines are high in phosphorus. So you have to watch out with that. You definitely want to be working with a dietitian who would provide you personalized, specific advice. And so some of those foods are healthy unless you have advanced kidney disease.
Yeah, I mean, I would be concerned just because there are so many foods that you would typically say, hey, it's great for a Mediterranean diet, chicken and tuna and turkey. And then you have quinoa, which is also said, if you listen to the Dean Ornish diet, it's great supposedly for people with diabetes and diabetes reversal and heart disease reversal and PAD reversal and kidney beans. I mean,
Yeah.
the sunflower seeds even, I mean, you have to stay away from them if you have low kidney function. And
Yes.
the other one, which I tell my
Dairy
patients,
products. Hmm.
yep, I was just going to say dairy products, huge issues still. I'm surprised how many organizations still promote dairy as a health food when so many of our patients with heart disease and PAD have low kidney function. It really surprises me. But I'm curious when it comes to, you know, diabetes, they do promote it for that as well, eating more dairy. And I have been told that dairy can cause inflammation in a lot of people, which inflammation in your body can lead to plaque buildup.
Yeah, I think so. Dairy is a mix. I'm enthusiastic about low fat dairy foods. So I do recommend in for most of my patients with diabetes who are not near the end stage of kidney disease, I am recommending low fat dairy foods like cottage cheese or Greek yogurt, because they're looking for especially breakfast alternatives, so that they're not eating bagels and pancakes and waffles and cereal, etc. So I think the evidence is in favor of low fat dairy foods if you're not satisfied to focus on fruits and vegetables and lean proteins at breakfast. So,
So when you do have people with both conditions and you're trying to create a diet for someone who has diabetes, chronic kidney disease, PAD, and heart disease, which it's more people than I would assume that people who are watching this are going, oh, that can't be. No, there are a lot of people that I would say would have all of the above. And it's really hard because you go to a restaurant, you go out to the store, and it's like, can't have this, can't have that, etc. But the one thing we were always asked about is carbohydrates. So you have a patient who's a chronic kidney disease patient. They can't fill up on proteins. They're limited in terms of their veggies. What do you think they're going to go back to? They're going to go back to those carbs, which is going to start the vicious cycle again. So, how should carbohydrate intake be modified when someone has both conditions? Are there any specific carbs that are better or worse than others? And what are your tips you typically give to your patients in controlling them?
Yes. Well, it's really a catch-22 situation with the carbs. If you reach a point where you're nearing kidney dialysis, you almost have no choice but to eat some starchy foods just because you need to eat something. You can't overdo the protein, you can't overdo the fat, you can't eat all the avocados and the nuts because of phosphorus or potassium. And so even whole grains have issues with potassium. And so generally it's recommended to eat high starchy foods like white rice or white bread or cereals, and those are bad for blood sugar and diabetes. And so the the best is these low potassium, low phosphorus vegetables, right? And so there's no rule that you can't have salad for breakfast, with lean protein in it. And many European countries have vegetables for breakfast. And so I would recommend that sort of thing. Um, I don't like the idea of people with advanced kidney disease having to go back to refined starchy foods, and that's, but sometimes there's no way to avoid it, and then you just make up for it with more medication and more insulin. And so I urge people who have signs of kidney disease or risk of kidney disease to take this seriously. You don't want to end up in the position where your dietary options are limited. And so foods like quinoa or barley or brown rice or other whole grains um, are usually better than the refined versions, but sometimes when potassium's an issue, you have to be careful with that stuff too.
What about, I mean, I know oatmeal is probably not the best option because that's both potassium and phosphorus, and that's not good for advanced stage kidney disease. I know a lot of diabetics turn to oatmeal to help lower their blood sugar and as an alternative to some of the other cereals out there, such as Cheerios in my dad's case. Oatmeal became a great alternative for him, filled with lots of berries and some walnuts as well. What about, let's say, as an option for breakfast for someone who has both diabetes and kidney disease, maybe a cashew milk or almond milk yogurt with a lot of berries and maybe some walnuts in it for a little bit of crunch and extra protein if that could be limited.
Yeah, that's a great idea, Kim, and I'd love to hear some of your other ideas about how to do that. So, yes, that would be right. A dairy alternative that's going to be lower in phosphorus. Yes, cashew yogurt made of cashew milk would be a good choice. And yes, strawberries, blueberries are good choices in there. And um, I like it. I'd love to
We're
hear
able
other
to
ideas you might have.
Well, what we do with my dad, because he doesn't thankfully, in his case, have chronic kidney disease. So he, flip-flops between having a couple eggs and some berries and an orange for breakfast one day. And then another day, he'll have his yogurt. He'll get forage or cashew milk yogurt, which to me seems to be the purest alternative milk yogurt that's available. We can't have dairy in our cases. I'm actually anaphylactic to dairy, so I don't even want it in the house at all. But we'll get a variety of different berries, raspberries, blackberries, blueberries, strawberries, and we'll just alternate between them for his yogurt or his oatmeal. But what I love about the oatmeal and the yogurt and even a smoothie, is that you can mix in additional supplements. So, for example, we grind up flaxseed and we grind up in a um, just a coffee grinder. And we use the coffee grinder to grind up the chia seeds and the flax seeds. And I even grind up the quinoa. And what I do is I put them in a little baggie and I measure them out. So there's a little bit. So my dad will just pour this powder into his yogurt or into his oatmeal or into his smoothie that he's making that day. And as you've talked about before, chia seeds are actually clinically proven to lower A1C, and in fact, they're contraindicated for people who are on insulin. So in high quantities. So that's kind of an interesting option.
Yeah, absolutely. Chia seeds, they have omega-3s and they can, yes, they're healthy as long as you don't overdo it in some cases. Absolutely. I love where you're going with that.
And you mentioned at the beginning about blood pressure, and I know that sodium is a big deal when it comes to blood pressure. So, do you want to dive into that and some of the foods that can help with that? I know that chia seeds, and I bring this up right now because chia seeds are also contraindicated for in high quantities for people who are on blood pressure medications because it can also lower your blood pressure.
The best thing you can do for your blood pressure is to lose weight. And so if you have excess body fat, weight loss and exercise are the most valuable. And then there's lots of medications that are helpful for lowering blood pressure and helping to protect the kidney. And so you want to work with your doctors, to make sure your medications are optimal, but everything works best when you're on the right eating strategy. So vegetables and fruits and lean proteins are terrific for blood pressure, as long as there's not a lot of salt. So salt, which has sodium, is an issue. And so processed foods have a lot of salt in them, and you want to take it easy with the salt shaker. But most of the sodium people are eating are in, canned and packaged foods. Deli meats do have a lot of salt in them as well. And so anytime you're cooking in restaurant foods, so anytime you're cooking for yourself, you're in much better control. And so you want to limit sodium. High potassium foods are very good for helping to lower blood pressure. And so all these high potassium foods that we mentioned are good as a preventative until the point where you're not able to tolerate them anymore. And so if you have mild kidney issues that aren't near the end stage, then you actually want to have fruits and vegetables with plenty of potassium. And so, tomatoes and, mushrooms and legumes and avocados, none of those are off limits because of high potassium. They'll help your blood pressure. And so potassium is kind of the opposite of sodium. You want those foods until you reach a point where your kidney just can't handle that, which is probably at a 25% kidney function or less.
Is it possible to reverse kidney disease to a certain stage? Because I know when my mom was alive, she was in her records, it said that she had stage 3, and then in the next couple of records, said that she went back down to stage 1.
Yeah, so the short answer is to a partial extent, you can allow the kidneys to heal. So sometimes you have temporary kidney dysfunction. So if you're ill or dehydrated, you might have temporary kidney issues that just go back to normal after you're well. But once you have chronic kidney disease, let's say you're at 40%, sometimes I see it go back up to 50%, but not like 70% generally. If I see someone with kidney function at like 20% and they're near dialysis, that's the most important time to be careful, because you can delay the amount of time until dialysis or maybe even avoid it altogether. And so someone's generally not going from, if someone spends a year at 20% kidney function, we're not going to see it go back up to 40% kidney function, but maybe 30% kidney function and stay there by doing a better job with eating and exercise and lifestyle overall. And so improvement or partial improvement is not unusual, but a total reversal of kidney disease, unfortunately, we're not seeing that.
And I think that what you're getting at is there is so much that we can do as individuals to prevent the progression of diabetes to get to the kidney disease, and from diabetes to peripheral artery disease, and from diabetes to CAD, coronary artery disease, and kidney disease and beyond, right? As well. But we've got to make the strategic choice to do it. We've got to actually get focused and get that sort of drive and diligence to getting this diet under control. The biggest pushback I get when I say it's up to you is I can't afford it. If you had to eat at the dollar store, then you would understand. But up to a point, I went to the dollar store in my area. They have a freezer. If you get there on the day of delivery, they have tons of vegetables in the freezer that you can load up for $1 a piece. Big things, big vats of vegetables that you can create stir fries and use to create soups. And then you have nuts. There's always nuts at the dollar store from my experience. What other suggestions might you have? You have a lot of the food banks that do have different programs where you can get at least some fresh vegetables. You can
Oh
go to
yeah,
farms. They have expired. There's some programs where they have expired, where it's like the day of, for example, Trader Joe's in our area they have to, get off their store shelves things that expire that day, but they end up donating them to different programs to other people who might, be able to benefit from some of their fresh vegetables that expire in another day that may be good for 2 to 3 days following.
yes, I think you hit all the main strategies. So very few people have extra money. We're all concerned about wasting money or spending too much on food. And the good news is, although um, some of the healthiest foods are really expensive, many of the healthiest foods are the best deals in the grocery store. And so, it's not that difficult to find vegetables for under $1 a pound. Cabbage, zucchinis, etc. And frozen are plenty healthy. Canned with low sodium are also all budget friendly. And fruits, it's not that hard to find fruit that's under $1.50 a pound. And so and then many people who have budget limitations are eligible for food stamps or the equivalent of that. And don't be too proud to accept that. When you're eligible um, for um, for that, I recommend it, and you can get discounts or subsidized food at the grocery store in many places. I recommend that. Food banks, yes, absolutely, and dollar stores, yes, definitely go to the dollar store. They have good deals on tuna and canned goods, and so most people who are
But look
being
for
budget
added sodium. You don't want added sodium.
right,
They can preserve in other ways when
right.
it comes to cans, so make sure you do double
Yes,
check
at the
that.
very least, rinse that. But the frozen vegetables are a better choice. So that's a good point. Many people are spending more money than they need to just on takeout and restaurant food because they get caught off guard. And cooking at home takes time and effort and advanced planning. And so most of my patients who are struggling financially are still spending money on takeout and other foods that would be better spent at the grocery store on healthy foods.
Yep, for that $8 pizza, you can get quite a few groceries that can last you for a few days. So make sure that you do take into consideration, that $8 could be better spent. You might crave that pizza, but it's not going to do you any good in the long run. One final question, because we get asked about this all the time. And it's so important. You inspired me. I ended up, because of you, I got a water bottle that has the measurements on it and tells me to drink this much by 8 o'clock, this much by 10 o'clock. And I'm supposed to drink two of those bottles a day. And because I started doing that, I'm drinking 3 bottles a day. I could not believe that by the time I was done taking my supplements and things like that, I was going through at least 2.5 to 3 bottles a day, whereas barely consuming maybe 2 glasses of water throughout the day. I always joke, my mom, me, my grandmother, we didn't like water. Blah. I remember my grandmother, blah, I don't want water. And she'd plug her nose and drink down her water. So it's a great way to do that because then you can add oranges and lemons and berries and things like that to flavor it as well. So I suggest getting one of those glass water bottles that has the measurements. It'll help you a lot. But what are your guidelines for proper hydration with especially these dual conditions? Does fluid intake need to be restricted? I would imagine with kidney, once you get to the end stage kidney disease, that becomes a problem. But leading up to that, what would be your suggestions as well? Please weigh both of those.
Sure. Once you're on dialysis, you have to be very careful. Your kidneys just aren't making any urine. You need to be very careful about limiting fluid intake and following, doctor's orders on that. But right up until the time that if you're not on dialysis, then of course you want to have fluid. You want to avoid dehydration. You don't want too much, but you don't want too little. And also, sleep is important. So you don't want to be up all night getting up to use the bathroom more than you truly need to be. And so get your fluid intake in, in the first half of the day, I recommend, especially when you're about to exercise, you want to be well hydrated. So I'm going to agree with your recommendation, Kim, on getting enough fluid, avoiding dehydration, and especially in these hot time of the year
Yeah.
where you're losing fluid maybe without even realizing it. So finding
And it's
balance when it comes to water and fluid is very important.
And it's important to have that discussion with your doctor, especially if you do have any stage of chronic kidney disease, because your medications may impact your hydration levels, your body's ability to absorb, how you sweat, how much you sweat, et cetera, et cetera. So, really important to talk to your doctor to say, hey, can you please customize a hydration plan for me? Because there's also with the foods you take, whether it's the salads, whether it's the fruits and watermelons and oranges and things like that, that might have additional fluids in there. You really do need to be careful. But one final question coming in from Becky. She asked about crawfish. Fish. Can she have crawfish?
So the short answer is yes. I like any kind of fish or shellfish. So crawfish does have phosphorus. So you don't have to, unless you need to worry about phosphorus because of advanced kidney disease, then go ahead and enjoy crawfish. I like that it has omega 3s in there and healthy proteins. Great question.
So really the limitations are if you have a really low GFR and you have been diagnosed with advanced chronic kidney disease, that's when you need to worry about those foods such as the high potassium, high phosphorus foods. Eating those as a diabetic is not going to lead you closer to chronic kidney disease. It's not going to lead you, and if you have chronic kidney disease, eating potassium and eating high protein foods or high phosphorus foods, those are not going to lead you to PAD,
That's
CAD.
right.
Okay, so it's the advanced stage that we're talking about where the limitations and the issues seem to occur.
Yes, it's a good rule of thumb is until your doctor tells you you need to limit potassium or phosphorus because of advanced kidney disease, then that's not the worry. The worry is you need to control your weight and your blood pressure and your diabetes so that you don't cause ongoing damage to your kidneys, so that you don't advance to the point where you're near dialysis. And so this is really all about healthy healthy eating and the same things that you would do to avoid heart disease and PAD are going to help protect your kidneys. It's just when you get into the late stages that it becomes very complicated.